Assalamualaikum and a very good morning. Today I would like to talk to you and to tell you on the topic of mental illness. Now, mental illness has been recognized since prehistoric time and have been dealt by using various methods available. Mental illness is actually a disease that affects the brain, which result in the disability to cope with life expectancies and normal routines. So I have done some research with regards to this topic, and today I would like to show to you that mental illness is getting more and more prevalent, and that the effort done by the countries around the world does not show how seriously they take this illness. Now, looking at the graph right over here, this graph represents the rate of mental illness in global populations according to World Health Organization's WHO 2010. Now, as you can see, mental illness is ranked number 3 and it is included under neuropsychiatric disorder. It is ranked 3rd after cardiovascular disease and respiratory infections. Therefore, it shows how serious mental illness can be, and it can affect the life of the ones they are afflicted with. It takes away 10 years of a person's life. Now, in comparison with HIV and AIDS, that people usually assuming they're very dangerous, which they are. However, they're not as debilitating as mental illness. In fact, the years affected by the patient with HIV and AIDS is twice less than the years affected by the mental illness patient. Now, next, we're going to look at the global response towards mental illness according to World Health Organization's WHO 2010. As you can see here, the mental health policies in more than 40% of the countries around the world are lacking. Health policies is actually something that the government and the hospital provide to the public as a guidance in order to identify and to treat mental illness patients. However, 30% of the countries around the world have no mental health programs whatsoever. So this creates lack of awareness among the people. They're not aware of the seriousness of this particular disease. Moreover, 25% of the countries around the world have no mental health legislations whatsoever. So in other words, the government have no strict laws concerning the act of those affected with mental illness. So if they commit a crime, they might not be able to be prosecuted fairly. They're not seen as someone that is afflicted with this disease that excuses them for some type of crime. Now, looking at this graph again, 25% of the countries around the world have no prescription drugs for treatments of schizophrenia, depressions, and epilepsy, which is very surprising because these 3 diseases are not that impossible to be treated with proper treatments and enough medication. Now, 40% of the countries around the world have less than 1 reserved hospital bed per 10,000 mental illness patients. Now, this is very surprising as well because it shows how much the government are not aware of the seriousness of this particular disease. Now, people, as a conclusion, mental illness is getting more and more prevalent, and that the government are not doing enough to treat this illness. So I suggest that the government provide enough treatment and create an awareness towards this particular illness, and that this illness should not be taken lightly in the future. Mental illness is like any other illness, so the government and the people at large should be encouraged to treat mental illness with a good attitude. Thank you.